Hello, my name is Anne Haylock. I'm an occupational therapist working for the North West Anglia NHS Foundation Trust. I'm here today to talk to you about falls, so giving you some information and practical advice on reducing the risk of falls. Let me also apologise in advance for any sort of disturbance in sound, because this has been recorded in my home studio and it isn't exactly high tech. So you can see from this agenda what we'll be covering in this session. I'm going to start off with some facts and statistics, looking at what makes someone at higher risk of having a fall, some ways that we can manage these falls risks so you reduce them so that you're then less likely to take a fall. We're also looking at improving the home and garden so that that makes you less likely to fall over, looking at things like trip hazards and having a tidy up, etc. We'll also be looking at adaptive aids that can be used to prevent someone from falling or reducing the risk, and where advice and support can be obtained, as well as giving out some practical advice. And lastly, we're going to finish out off with what people can do if they've already been unlucky and fallen. So we'll start off with some facts, and I think it's important to know here that we're kind of differentiating between sort of someone who's stumbled and fallen out over and kind of someone who has taken a fall, which tends to be a bit more serious. You're kind of thinking about more severe injuries, and it generally tends to be maybe those who are a little bit older. So for people in that category, falls can be quite severe, can take away someone's health and independence, and it can cost the National Health and Social Services combined a total of 4.4 billion per year. So it's quite a serious issue. It's estimated that 1 in 3 people over 65 will fall every year, and many of them are in decent health, and not all of them get severely injured or particularly injured at all. But this risk increases as people get older. So nearly half of people over 80 will take a fall once a year, and then as you get older, your bones might be a bit weaker and more brittle, and you're more likely to sustain sort of severe injuries where it might be difficult to recover afterwards, needing long-term care, a hospitalisation, possible surgery, a long recovery process, and then maybe not quite regaining the level of ability that you had before that fall happened. But falling isn't always a part of getting older. A lot of falls can be prevented through simple lifestyle changes and also taking some precautions, which we're going to look at later. Also, a fall can be a warning that something isn't quite right, so you shouldn't just take it for granted that if you're getting older, you're falling over and that is a normal thing. So we're looking at some of the factors that might increase your risk of falls. So as I said earlier, anyone can obviously be unlucky and fall over. I have fallen myself on many occasions. It happens. But some risk factors make it more likely to occur, and if you think you're in a particularly vulnerable group, then it's worth looking at some of these. Sort of having multiple of these factors is obviously going to make your risk more severe and possibly the outcome more severe as well. So for those who might not be able to read a PowerPoint, I'm quickly going to go through the list. So a previous fall is a big factor of predicting future risk of falling, especially if you've not told or seen anyone about it. Also, people who are on a lot of different medications should have regular reviews, because some meds might over time not have the same effect or the effect that they should have, so having a review regularly, sort of at least yearly, is important to talk to your GP about, as that can reduce your risk of falls. If you're someone who has to get up multiple times in the night, can pose a risk, and also if you're less active. Feeling dizzy or lightheaded when you stand or when you're walking, struggling with home maintenance so that things, like carpets become a bit tatty, there's trip hazards, you may be dropping things and it's difficult to pick them up, or things just get a bit overwhelming and it's hard to tidy up and it gets a bit cluttered, that kind of thing. Not having regular eye tests, wearing glasses that are of an old prescription that maybe you don't see so well in anymore. If you're feeling weak when you're getting in and out of bed or out of your chair or on and off the toilet. Mentioned about the home earlier. Not having appropriate seating, so for example having a chair or a settee that is much too high for you, you're at risk of sliding off it. Not drinking enough and being hydrated might cause you to become a higher risk of falling. Obviously wearing worn footwear is not ideal, especially very loose shoes and slippers that are going to drag around. Not taking care of your feet. Certain long-term conditions can make you at higher risk of falls. Walking around in the dark, not having adequate lighting in your property. Drinking too much, or remaining indoors so that you don't get sort of practice on walking on slightly uneven surfaces to strengthen muscles and improve balance. Sometimes pets or children can get underfoot as well. And interestingly, not staying warm at home can make you more prone to falling. So how can we reduce some of these risks? So like I mentioned a little bit before, a previous fall is the biggest factor in predicting future falls. So if you have ever had a fall, you should speak to your doctor or healthcare professional about it, because they might signpost you for a falls assessment so that they will look at some of the risk factors that we just spoke about in the previous slide, and looking at how that they can reduce that and signposting to potential other professionals to help with that. So we can't stop growing older, but we can improve our health and lifestyle, making just some few simple changes to look after ourselves and our environment a little bit better. Things like working on your balance. With age, your balance and reaction time slow. So does your reflexes. That can make it very hard to regain your balance if you were very unlucky and you happen to overreach, sort of reaching things in a high shelf or cupboard, or bending down to reach something that was low down. You might not be able to regain balance if you're starting to go. However, doing some gentle exercise on a regular basis can help with that and reduce your risk of falling. The same with the muscles. Muscles weaken with age, and they reckon that about 30% of muscle is lost between the age of 50 and 70. And if you've had, for example, a hospital admission where you become very inactive, might spend several days in bed, this can lead to 5% of your muscle strength being lost each day. So it's devastating for the elderly population. And obviously if you're taking to your chair or bed at home, similar situation, and it can be very hard to come back from. So keep active and do regular physical activity, which will also help with, like we said, your balance, but also your stamina, so that you are able to sort of get from A to B where you need to go without any issues. Incontinence is another thing, and something that people are often quite embarrassed about and don't really want to talk about. But actually, not managing your continence very well might cause you to fall over, because if you're rushing to the toilet, obviously that's going to pose a risk, because we don't want to be rushing. We want to be taking our time and looking where we're going and making sure we're thinking about what we're doing when we're moving about. Getting up in the night when you're tired and maybe half asleep when it's dark, that's not going to help either. So we'd recommend that you talk to your GP or any other healthcare professional that might be involved with your care, if any, and maybe get the ball rolling on an incontinence referral. people are very happy to talk about these things, and if you haven't got anyone involved already, this is something your GP can start the ball rolling on, and they are obviously very used to dealing with these kind of things. Something that might help is having a commode or like a urine bottle next to your bed or on your bedside table at night. Obviously don't put the commode on the bedside table, that would be for the urine bottle, but the commode could sit on the floor next to the bed, so that you don't have to walk around in the dark. You could just get out of bed onto the commode, which would be safer than walking. Also, as we get older, our eyesight changes. In general, a lot of us tend to become long-sighted, and we also experience a decrease in contrast sensitivity and depth perception, which can make steps and uneven and not level surfaces be a bit of an issue. So yeah, those factors combined can make obstacles difficult to see, especially if you're out walking and there's suddenly a curve there. So it's important that you go and see your opticians regularly and make sure that your glasses prescription is up to date, so that you are fully aware and able to see where you are going and what is in your path. Another thing that maybe people don't think so much about with regards to falling is having adequate seating. Mentioned it slightly earlier about sort of having too tall a chair or a seat or something where you might slide up, but it's very important to have something good to sit on that is a good height for you personally, so that you can get in and out of it easily without too much of a struggle. Ideally, you should be able to sit right back in the chair so that you sort of back of your bottom touches the backrest, and you can sit back comfortably with your sort of your hips and knees at 90-degree angle and your feet flat on the floor. That is generally the ideal height for people, but if you struggle to get out of that and find it really difficult, there might be something like a chair or settee raiser that can help just raise it up that little bit, so that it gives you a little bit of to get out of your seat. Because if you struggle, you might get off balance, and also it can make you very tired putting all that effort in just to standing out of the chair, and then once you're up, you've got to walk to wherever you were going to in the first place as well. So you need some energy for that. We tend to say that armchairs are better because they've got the armrests that you can push up from, and they are generally a little bit more supportive as well. As people get older and weaker, they find settees slightly more difficult. Riser recliner chairs are becoming increasingly more popular. They can be quite pricey, so I would recommend that if you are thinking about getting one of them, to get them from a reputable place and make sure that they actually measure and assess you properly when you get it, so that you don't end up with an expensive bit of furniture that actually isn't right for you. So we spoke briefly earlier about the importance of keeping active and doing some exercises to maintain your balance and your strength and your stamina, which all will help with better mobility, so that walking's better and you're reducing your risk of falling. Gardening is a good activity as long as you can safely manage it. I'm not suggesting that if you were never into gardening, you suddenly go out there and start digging up flower beds and planting big trees and things like that. But, pottering around in the garden, deadheading, just getting some movement and sort of moving your muscles in different ways is a very good way of keeping your balance and your core strength good and working. Housework is another activity that is very good, where you get lots of various movements that will keep all your different muscle groups strong, as well as helping with your balance. Walking is brilliant. Keep walking as much as possible, little and often, whatever, just keep moving. There's also exercise classes like yoga or tai chi these are often adapted based on, what level you're at, so you can have seated exercises, so up to, full blown standing on a beach with all arms and legs in the air at the same time kind of thing. And yeah, really something for everyone to engage with there. Just also remember, whatever you do, especially with thinking about gardening and housework and things like that, is to keep a good posture. Try not to stoop, twist or overreach so that you become off balance. You should always try and maintain so that your back is straight to prevent injury and falling over. I think the recommendation from the NHS guidelines is now that you should move sort of gentle activity 5 times a week for 30 minutes, and then incorporate some strengthening activity in that as well to keep your bones and muscles. Moving on to your home and what you can do to make that a little bit safer for you to manage. I think we spoke before about walking around in the dark. It's important to ensure that you have adequate lighting both through the day and the night. Turning off all your lights to save on energy really is not a good idea. At least if you do that, make sure that you can reach light switches, etc. when you have to get up and walk so that you can actually see where you are going. Also make sure that you don't have things plugged into extension leads and stuff that are trailing right across your walking path. Make sure that any leads like that are kind of kept out of walking areas and preferably up against walls and maybe tacked in place as well so that they don't sort of come loose and make their way into where you're going to be walking. Also try your utmost to keep your home clutter free so that you are free to move around. Even like stacking things up high on shelves and things around you isn't that good of an idea because things can fall over into your path if you brush past it as you're walking through. Also make sure that your doors can fully open, especially so that they don't come back, swing back on you as you're walking through and kind of knock you and make you off balance. Or if you have to squeeze through maybe with a walking aid, you haven't really got enough space there, that could end up being a bit of a disaster. It's important to check your carpets. If you have carpets on the floor, that there's no kind of loose treads that you can get caught on, or frays or loose corners that you might stumble over. We also recommend that you remove any loose rugs and mats because they can pose a trip hazard, and although they look pretty, I'm sure you'd rather be safe than sorry. Try not to store items on the stairs. I know there's lots of really nice stair baskets and things like that you can put stuff in, but surely there must be a better place to put them than actually on the stairs, because even if they're off to one side, one day you misjudge where you're stepping, you hit that basket, and next thing you might be tumbling down the last few steps, and that's really not what we want. And try and ensure if you have any pets that they don't sneak up on you and trip you up. I know my cat is terrible for doing that. He's a bit of a liability to help, really, that one. Kind of a bit like that dog in the picture there. Other things that you might consider to make your home a little bit safer and things a little bit more easier for yourself is to reorganize some of your kitchen and bathroom cupboards and shelves, especially those that are very high up or very low down, so that you move the items that you use the most often to easy to reach levels. Maybe even have them out on your counter if that is possible, so that you don't have to be reaching on a regular basis for those. If you have an accident and you spill something, consider having like a long-handled mop so that it's easier for you mop it up and get rid of that spill immediately so that you don't forget, and then the next time you walk in that area you might slip in it. It's really not ideal. There are things like perching stools that can help with kitchen and bathroom activities if you're finding it a bit difficult to stand up for longer periods of time and that makes you feel tired or your muscles ache, which obviously can lead to you then falling over. So you can have little breaks on stools like that, especially if you're cooking dinner, which can take some time at times. There are also seats that are suitable to use in the bath or shower that can be obtained and used so that you can safely sit down while you have a wash, making it less likely that you're going to slip or get tired when you stand to do that. Another thing is grab rails. The grab rails come in lots of different shapes and sizes, and they are ideal for putting around in strategic locations to give you some support with like getting in and out of baths, on and off toilets, etc. And now, if you know someone that have visual or cognitive difficulties, a lot of the same rules apply. Always keep the property tidy and clutter-free to the best of your ability. However, I would not drastically change the environment for someone with cognitive or visual difficulties in a short space of time. That is because people with visual difficulties may be very used to navigating their property by the layout of their furniture and various other items that they have along the way, and they might rely on these as well for regular handholds as they mobilize through. It is kind of how they find their way through the property. Obviously, any clutter, anything that's on the floor composing an immediate hazard, it's fine to pick that up and maybe making small gradual changes over time if needed, but obviously along with the person making sure that they are fully aware, and that you show them, take them through and show them what it is that you have done so that they can get used to the new layout. People with cognitive difficulties can become very confused if you suddenly and drastically change their environment, and they might struggle to function as a result because they're very used to their layout and sort of manage their routines accordingly, getting prompts and cues from their environment around them. If you then changed it and they won't recognize it, it might completely throw their schedules and routines out of the window. So if the property is hazardous, deal with the most immediate risks first, sort of getting rid of clutter and mess lying around on the floor and things, but sort of be careful with changing bigger things and do them gradually so that it's not too upsetting all at once. So, what have we learned so far? Looking at this picture, do you think that this is safe? Can you think about what some of the problems are here? And then can you think about a few sort of 5 suggestions that might make this a safer environment to live in? I'm going to give you sort of a minute to think about that, and then I am going to just highlight some of the things that I feel is a problem here. We could have done with a little bit of background music here, but unfortunately my setup isn't that high tech. I hope you can't all hear me breathing while you're doing this. It's nearly been a minute now. And so there we go. Have you all thought about something? Let's see if you have maybe thought about the same things that I have. So there is obviously clutter everywhere. Clutter means trip hazards. There is plenty of them, not just with the things on the floor, but obviously it's very tight around there. Quite a lot of furniture in a small area. The shelves are stacked high with things. You could brush past some of those and things might fall into your path as you're walking past. There's not really much safe space to walk there, especially if you're thinking of someone who might be using a walking aid like a rollator or even a stick. There's things left on the chair, so if someone who is quite poor on their feet come through there, they're going to have to clear the chair before they can even sit down to rest, which is not ideal. There is trailing leads there as well. They should have been tucked away safely. And that was it. Alright, moving on to the garden. So if you do like to access your garden, just make sure your garden is safe for you to do so. I would ask if you can, if you're not able to look after and maintain your garden and your garden parts yourself, see if a friend, family member or possibly a local charity can assist with a bit of maintenance and upkeep for you. There are lots of charities available for that kind of assistance, and I'm sure that friends and family, if available, would be more than happy to help to keep you safe. Ensure that parts are safe and that there's no big cracks or weeds growing all over them which might get wet and soppy that you can slip in. Also make sure there's not sort of pebbles and gravel lying about that you might step on and sort of lose balance. Adequate lighting if you go outside, especially in the evening time. You don't want to be going outside in your garden in the dark where you can't properly see where you're going. If you have big steps or multiple steps sort of at your back door or anywhere in the garden, think about whether you could have some rails or sort of outdoor banisters put up to help you safely navigate those. If you have big back door steps, with a lot of people actually do, might consider putting in a half step there and maybe a rail also by the door so that you have something to hold on to. Put a couple of pictures on the bottom there to sort of demonstrate a point a little bit, so you can have a see and see what you think the problem might be in those two pictures. There won't be an answer provided for this. You kind of just have to think about it yourself and then live in suspense. Alright, moving on. So, after all of that, what can you do if you are concerned, if you have sort of thought to yourself that some of these might be an issue for me or my loved one or someone that you know? So, in the first instance, you can talk to your GP or any other healthcare professional. I think I mentioned earlier that they can then signpost you for someone who can complete a falls risk assessment with you and work through how you can minimize the risk so that you don't have a fall or further falls. Doctor and healthcare professional might be able to advise you on support that is available locally, like if you're struggling with home maintenance or garden maintenance, if you struggle with your walk-in or you're particularly worried about anything in your home, they might signpost you to, for example, occupational therapy. But there are a few things that you can do to help yourself as well. and that is when you are up and about and out and about walking, try not to rush, look where you are going, make sure that you're not going to be surprised by any steps or obstacles in your way. Don't care about what other people think, just take your time, as much time as you need to maneuver around safely. If you go out shopping, try not to overload yourself and do like a big weekly shop on your own and carry that home by yourself. Maybe ask someone for help if you need to do a weekly shop, or consider if you are au fait with sort of online shopping, you can do telephone orders and have shopping delivered to you. Again, there's local charities that might be able to help. Just tap into resources and help and keep yourself safe. We spoke about the changes in floor surfaces, and obviously if you're out and about, taking care that you know where the curb is, and if you have to negotiate a curb, that you are careful and sort of preparing yourself for it. We said about keeping items that you use regularly close to hand and easily accessible, so maybe that means reorganizing your space a little bit at home. If it's safe to do so, try and practice getting up off the floor. Sometimes people fall over. They haven't necessarily hurt themselves, but they just cannot get up off the floor, and there has been incidents where people have been stuck there for a very, very long time, which might have dire consequences in itself, because obviously while you're lying there on the floor, you're not able to get hold of drinks or going to the toilet, keeping yourself warm. So if you can practice techniques, if you're safe to do so, to keep doing that on a regular basis, but make sure that you do that when you have someone else there who can help you, just in case. And I'm not suggesting that people who know for 100% fact they aren't going to get up off that floor again, that they do this, but this is a preventative thing for people who are a little bit more able and who might be able to get off the floor. Just practice doing it, so that if they had an accident, the likelihood that they have worked out a technique where they can get off the floor is going to help them in that situation. Another really important thing that you can do to help yourselves is that if you have been given a walking aid, please use it. You don't get any medals for being brave, or proud. If you've been given an aid, please use it. It's for a reason. It will stop you from falling, because it just does provide you with that support that you actually need. And if you don't have a walking aid, but you're feeling a bit unsteady, again, you might be able to talk to your GP about it, who can refer you to a physiotherapist for an assessment, so that you can get a walking aid appropriate to you. So continuing on with things that you could do to help yourself, ensure that you have a decent pair of well-fitting shoes or slippers that aren't too worn. We don't want to see sort of shoes and slippers that are 3 sizes too big or 1.5 size too small, with the big toe sticking out the end of it. It's just not helpful when you're walking, so the walking around in shoes that are falling off your feet as you walk along is going to pose a massive false risk. Just, having one pair of decent fitting footwear can really help you. And also, don't walk around in just your socks, especially if you have slippery flooring. I mean, even carpet can be quite slippery if you're just in your socks. It's best to wear shoes or slippers. Also try and make sure that your clothing doesn't trail or hang off you, because it can get caught under the heels of your shoes, making that slippery, or it can be caught on things as you're walking past, sort of getting you off balance so that you fall over. Also, try and think about lifting your feet and don't shuffle along, because shuffling you are going to find some trip hazards for sure. It's better to lift your feet up and walk sort of properly if you're able to do so, or do so to the best of your ability. Also look after your feet and keep your nails short so that they are comfortable. Might be worth to see a chiropodist on a regular basis. And if you have painful or swollen feet of any kind, please see your GP about it, because walking around on sore feet is not going to help either. Moving on now to other bits of equipment that might help. So we have already spoke a little bit about walking aids, but there is worth mentioning that there are quite a few available. Things like sticks, elbow crutches. You've got the wheeled Zimmer frame up in the top right corner there. We got some four-wheeled walkers kind of below it, which are really good for some people because they take them when they go out and about. Then they got little basket to put some shopping in and a seat that you can sit and have a rest on. Similarly with kitchen trolleys, you can't sit on those, but you can cart things around your property with them, which can be handy so that you have some support while you're walking and you don't have to carry things like hot drinks and dinner plates around the place. We spoke earlier about fitting grab rails in strategic locations to sort of help you get in and out of baths or shower steps or on and off the toilet, by steps, by front and back doors. Lots of uses for grab rails. If you struggle getting on and off the chair, the settee, the bed or the toilet, there are various racer equipment available. Below that rollator frame at the top right, there's a picture of what we call a combi toilet seating frame sitting over a toilet. That gives you a little bit of height as well as some arm support to push up from, because remember what I said about your armchair earlier, it's much easier to stand when you have arms to push up from to steady you. That is how we recommend you stand, by the way. You should not pull up on your walking aid, because your walking aid might tip towards you and actually cause you more of a false risk. So when you do stand up, then push up with both hands onto the seat or the armrest of the chair, and then when you get into standing, move one hand onto your rollator frame and then the other one, and make sure you're steady before you step off. Something else worth considering, I said earlier about people falling over and not being able to get up off the floor. Sometimes in that situation you might not be able to call for help. I don't know how often people have visitors, but I know in my house I can be on my own. Well, if my other half went away for the weekend, I might not see anyone and no one might miss me until I'm missed for work on the Monday. So having something like a pendant or bracelet alarm to call for help if you have fallen over can be an absolute lifesaver. There are also other various tech available, for example, for people with cognitive difficulties who might not be able to use a pendant alarm because they wouldn't maybe remember to press the button. That is tech that would notify sort of maybe a relative that lives close by, or a representative that's been allocated. And the kind of thing we're talking about there are like sensors that can go on the chair, or bed mattresses that will notify someone if the person gets up, and if they haven't returned again within sort of say 20 minutes, that kind of thing, and then that would indicate that maybe something has happened. Why haven't they returned back to bed? They might either have fallen over, or they might be wandering, in which case someone might want to check on them. Again, your GP or any other healthcare professional can be able to assist you with a referral to relevant services for all of the above. So what can you do if you have been unlucky and have fallen over? Try and get help. So use your pendant alarm, or if you have any pull cord systems in your property and you can reach them, try and get to those. If you have your phone on you or near at hand and you can reach it, dial 999 or anyone else that might be able to help you. Bang on walls or radiators to try and sort of get attention from your neighbours or maybe passers-by. Banging on radiators makes a lot of racket, so that might be a good way to summon some assistance. While you have fallen over, if you're not able to get up, try and stay calm and keep as warm as possible. If you can reach anything that you can cover yourself with, like a coat or a blanket or anything at all, try and get hold of that and put it over yourself. Maybe if you also can reach something to put under your head to make yourself as comfortable as possible, that's a good idea. Try and move. If you're in pain and you think you've injured yourself, obviously just move as pain allows, but try and move all limbs if you can. If you're able to shift position, then that's good, because you want to prevent sort of pressure sores and things like that developing. And also, if you can reach anything, it might be unlikely, but if you have something nearby that you can reach to drink, try and keep hydrated. So, to recap, some of the main pointers here. Exercise regularly, keep moving, even if it's just a little bit. Something is better than nothing. And just getting up and walking around your property every hour or so, if you can, would be brilliant. Obviously, the more you can do, the better. See your GP or talk to someone if you've already had a fall, because having that early input and an assessment of your falls risk might prevent you from having several more falls and maybe possibly more severe falls in the future. Get your eyes tested regularly and make sure your prescription is up to date so that you can see properly. Foolproof your home and get assistance with this if you haven't got anyone close that can help you. Make sure you have got good, suitable, sturdy footwear that you can actually comfortably and safely walk around in. And please, please invest in a pendant alarm. They are a really, really good idea, and the cost is really insignificant for what it might help you if you should be so unlucky and fall over. Lying on that floor for hours, it really is no fun, and it can have dire consequences. And look after your general health and well-being. And there we got some references to finish off with if you want to read any more about falls and falls prevention. So I hope you found that useful and informative and given you some things to think about. Like we've said, falls is severe. It can have really big impact on people's lives. So do have a think about it. Think about what you can do to help your loved ones stay safer, and reducing the falls risk. Thank you so much for listening to this presentation. Thanks.